Hey everyone, Dinesh Sirisena here, and today we're going to be talking about injections to the tibialis posterior tendon. As with my previous video, I recommend having the patient lying in a prone position. You can roll a towel and put it over the anterior aspect of the shin to make it more comfortable for them. And the reason for this is that firstly, the patient will be more comfortable, and hopefully the ankle will be more stable when you're undertaking the injection. And this is how I would undertake the injection. So having the transducer either in a short or long axis orientation across the tibialis posterior tendon, you can bring the needle in using an in-plane approach. When you are in the short axis orientation, ideally you want to bring it from the anterior aspect. So using the tibia as a guide, you want to guide the needle into the tendon if, let's say, you're doing a PRP or prolotherapy injection, and then in which case you will use a fenestration technique to distribute the substrate, or you want to bring it to in between the tendon and the tendon sheath if you're doing, say, a corticosteroid injection. In the long axis orientation, you may bring the needle in at a slightly steeper angle, and again, you want to bring it into between the tendon and the tendon sheath if you're doing a steroid injection, or into the tendon itself if you're doing PRP or prolotherapy. In both situations, it's good to draw back on the needle to make sure that you haven't inadvertently struck any neurovascular structures before you inject the substrate. And so this is what you're hoping to see on the ultrasound. In the short axis orientation, you should see the tibia, you should see the tibialis posterior, and what you're aiming to do is try and bring the needle in as horizontal as possible into either the tendon itself for PRP or prolotherapy, or into the space between the tendon sheath and the tendon if you're doing steroid. If you are using a long axis orientation, again, you need to bring the needle into the tendon if you're doing PRP or prolotherapy, or in between the tendon sheath and the tendon if you're doing steroid. The angle in the long axis orientation may be slightly steeper, but in both situations, using a in-plane approach is most appropriate. It's useful to use a transducer with a smaller footprint because then it means less tissue has to be traversed in order to achieve the injection. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram, and TikTok, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.